This presentation is about lupus. What is lupus? Lupus is a chronic autoimmune disease, which is a chronic inflammatory disease where the body's own immune system attacks itself. One's body attacks its tissue and organs, such as your joints, skin, kidneys, blood cells, brain, heart, and lungs. There are 4 different forms of lupus: systemic lupus erythematosus, cutaneous lupus erythematosus, drug-induced lupus erythematosus, and neonatal lupus. What causes lupus? Well, there are genetic factors and environmental factors. At this time, there's been no single gene or group of genes that is proven to cause lupus. It's really unknown, but they know that with genetic testing, it does show distinct sets of autoantibodies that are associated with specific genetic risk variants in African Americans and European patients. Inheritance predisposition may be triggered by the environment, such as sunlight exposure, or medications, such as anti-seizure medications, blood pressure medications, antibiotics, but it does appear in certain families. Example would be of 2 identical twins, one getting lupus, the odds are that the other one will also get lupus at some point in their lives. So there have been some factors showing that genetics does play a role, they just haven't figured out exactly how. So who gets lupus? It's more common in African American women, and it's estimated that 1.5 million Americans have lupus. Most often it's diagnosed between the ages of 15 and 40, also known as the childbearing years for women. And other than that, anybody is susceptible to lupus of all descents. There isn't any one particular, but it seems to be that more African American than any other genetic background. There are various symptoms of lupus that can range at different times during what they would call a flare-up, but it's also very hard to diagnose because most of these symptoms also have to do with other autoimmune disorders, so it is kind of hard for them to pinpoint. It takes a long time for lupus to be actually diagnosed because the symptoms are extreme fatigue, headaches, painful or swollen joints, fever, anemia, swelling in feet, legs, hands, and or around the eyes, pain in chest on deep breathing, butterfly-shaped rash across the cheeks and nose, photosensitivity, hair loss, abnormal blood clotting, Raynaud's phenomenon, mouth or nose ulcers. One can have some of these symptoms, one can have all of them. It just depends on the time that the onset of lupus and the flare-up. There are the treatments for lupus. There is no cure, and medications are prescribed to basically manage the condition, but there isn't anything that cures it. So at this time, the manageable physicians will instruct to take prescribed medications such as aspirin, acetaminophen, NSAIDs, corticosteroids, antimalarials, immunosuppressives, anticoagulants, and monoclonal antibodies. All of these are to treat the symptoms and to make the patient more comfortable, but there is no treatment for lupus at this time. Basically, the best thing someone with lupus can do is have good lifestyle changes to make sure they get plenty of rest, they protect themselves from the sun because they are extremely sensitive, get adequate exercise, no smoking, and having a healthy diet will all help them have a better quality of lifestyle for themselves and to basically be comfortable, since there is no cure for lupus at this time.